we're taking a look deep at how you can keep the brain healthy, and here to share more is Dr. Lela. Welcome to the show.
Thank you, Amber. What a delight. I look forward to this morning.
Yes, I love hanging out with you, and your approach to medicine is so interesting. So let's talk about brain health. This is so awesome.
So this is Alzheimer's and Brain Awareness Month. So I always question, like, why does something need its own month?
Right.
Like, brain is only 2% of body weight, but it gets 15 to 20% of our blood supply goes through the brain every minute. So proportionate to the size, it gets a lot of blood because it needs all the oxygen and the nutrients to do all the work that it does. So that's why it deserves its own month.
Absolutely. And when we talk about brain health, of course, we have like the articles that we see that are top 5 things to keep your brain healthy. But what truly is brain health?
So brain health is all the functions of the brain that it has to do. So even small things, like I often have people say I'm foggy, or I can't make a decision to save my life, or I'm not sleeping. That's brain health. So it's not just the things that we have labels for, the anxiety, the depression, the ADHD, schizophrenia, Alzheimer's, or stroke. You know, it's everything that we do, the brain function has to do with it. It's our command central is how I describe it.
Yeah, absolutely. And sometimes mine is not always working. I probably need your help. So how
you need to reboot it.
I need to reboot it every second of the day most of the time. But talking about brain health and how your approach to it is very unique. It's very holistic, and I'd love to learn more about that as well.
So everything I do, I start with, what are you feeding it? What are you feeding it? What are you not supposed to feed it that you're feeding it? What should you be feeding it? And then what toxins are you getting?
Interesting.
And how to get rid of them. And then is there inflammation and how to fix it? So that's, you know, always with inflammation, I go to gut health.
Yeah, absolutely.
So that's my approach to anything, and that's how we approach. But you know what? I don't actually wait for people to get symptoms.
Right.
I start brain health or health in general as soon as somebody decides to be healthy, or as soon as they come to see me.
Interesting.
So, you know, we can break it down if you want.
Yeah, absolutely. That would be great.
So the biggest thing is, you know, Hippocrates, the father of medicine, 3,000 years ago said, use your food as your medicine and your medicine as your food. And we have totally forgotten that. Right? Because nobody talks about nutrition, nobody gives any guidelines on nutrition. If there is a pill, it's very easy. Of course, doing it with food is much harder.
Right, absolutely.
And then there are so many diets.
Oh my goodness.
Like, which one do you pick?
Absolutely.
So I don't subscribe to a particular diet.
I love that. Absolutely.
And I don't, you know, oftentimes people also go, well, it's my genetics.
Oh, yes.
Right? It's such an easy cop-out. But in functional medicine, we say genetics is only the loaded gun. It's a loaded gun on your bedside table. You need to pull the trigger.
Well, I cannot wait to learn more on our next segment and follow in more into this. This is so interesting. Well, Dr. Lela, we're continuing our conversation, and we're talking about the trigger for brain health.
Yes, so you know, you have your gun on the bedside table. What actually pulls the trigger is everything that we talked about earlier. So your microenvironment, or the cells, are bathed in these things, either good nutrients or not, toxins or not, inflammation or not.
Interesting.
So let's break it down and just focus on one thing, nutrition.
Absolutely.
Okay, so what do you eat of all those diets, right? I don't subscribe to a particular diet. I would say eat a balanced diet that has proteins, carbohydrates, and fat. We need the proteins because we need the amino acids to make the neurotransmitters like serotonin. You know, a lot of people are on Prozac, which is a serotonin reuptake inhibitor, because they have low serotonin. So if we can eat proteins that have tryptophan that converts to serotonin, then we can work on getting off medications.
Interesting.
So simple things. So have enough proteins, have enough fiber in your diet, because the fiber feeds your gut bacteria. And that's very important. Have good fats. Why? Because you need the omegas, you need the essential fatty acids. And where do we get those from? We can get those from fish, sardines, salmon. We can get that from egg yolk. If you're plant-based, you can get it from nuts and seeds, walnuts, pecans, pumpkin seeds, chia, flax. The key is never roasted, because the roasting process
Oh,
alters the fats.
interesting.
It has to be raw nuts and seeds. So chia pudding is one of my favorites that I put all my patients on.
Absolutely. I love that. And
Yeah.
it's so easy to make as well.
It is, it is.
So interesting.
So always go to the foods, and it doesn't have to be, here's my greens and here's my protein. Vary your diet, because variety will bring in different nutrients. For example, beets or leeks or even ginger, garlic, onions, all that has different nutrients which our body needs. So always bring variety in. What not to do?
Yeah.
Sugar. Now everybody's going to hate me.
We knew it was coming. We knew it was coming.
Yeah, sugar is very inflammatory.
Yeah,
so I'm not
interesting.
saying don't eat any,
Right.
but you know, if you're using sugary drinks, hot or cold, then that's really something that I would recommend getting off of. Even diet drinks, you know, because they have so many chemicals that break down the gut lining. And leaky gut is leaky brain. If your gut is healthy, your brain is healthy.
Right.
Also, like now people are saying Alzheimer's is type 3 diabetes. So again, we come back to the sugar.
Interesting.
So it's really important to, and then processed food is another one. The more processed a food is, the less nutrient it has, the less fiber it has, and the more toxins, because the can or the plastic is putting in toxins in the food. So eat as much fresh as you can, as close to how nature made it to be. Cooked at home, so you're using good oils, you're using olive oil, you're using butter, because those are good fats, and have fun with your food. Involve the kids in this activity, and teach them good habits.
Absolutely. Well, Dr. Lela, thank you so much for shedding light on this. I definitely go visit her over at her website. Give her a call today. She is such a wealth of information, and she is absolutely incredible. So thanks for sitting down with me today.
So much.
I'll see you in 2 weeks.
Pleasure, yes.
Yeah, absolutely.